So good evening, everyone, and welcome to the Decatur Parents Network. And Marnie, you can go ahead if you want and just note that everyone, there is a crisis number here up on the line. So if you or anyone you know is experiencing a crisis, please know that there is help 24/7 available for that. And we just wanted to put that out there right at the very first this evening. And with that, I believe, Marnie, you can drop that off. There we go. Okay. Thank you very much and welcome everyone. I know we're starting almost right on time tonight, but part of that is because we have such a filled evening with us this evening. We have 3 panelists and a moderator, and you're going to get to hear from all of them. We want to thank you for coming and joining us. I know that as I was looking, people will be joining, I suspect, all through the evening, but we have about over 100 people who've expressed interest in this. And we know that this was a topic that you guys wanted us to cover because we did a survey this summer in the community with the Decatur Parents Network. And 71% of the parents indicated a desire for us to address mental health issues, which is why we are doing this tonight. Again, my name is Terry Moore, and I am with the Decatur Prevention Initiative, as you can see in the back. But another hat that I wear is that I am a proud founding member of the Decatur Parents Network. And some of you are already Parent Network members, but if you're not, please go on to decaturparents.net and consider joining us. We're a community of parents, caregivers, and friends promoting a nurturing environment that encourages teens to make smart, safe choices. And we have a directory of over 450 parents and about 300 friends. And so that is a great place to get extra support in this community. We are going to have lots to do tonight, but I do want to just encourage folks. Another topic that came up in the community survey was the need to address teen suicide. And that topic we felt like deserved an evening of its own. And so although we may be touching on that tonight, I do want you to know and go ahead and put it on the calendar and look for the promos. September the 9th. We will be having a total evening devoted to that topic. But in the meantime, do know that there are resources out there for you, and all of our panelists tonight will be giving you their email addresses on how to contact them as well. Our wonderful moderator tonight is Dr. Lily Huddleston, and Dr. Huddleston is the Associate Superintendent of Equity and Student Services at the City Schools of Decatur. She is a licensed psychologist specializing in school psychology. Dr. Huddleston has held faculty appointments at Georgia State University and Emory University, where she provided clinical services and conducted research with individuals from underrepresented and underserved communities. Dr. Huddleston has presented on diversity, equity, and inclusion at state, national, and international conventions, and has co-authored and authored papers on a range of topics relating to child and adolescent development. We are very lucky to have her in Decatur. She was hired as the Equity Director for the City Schools of Decatur in 2017 and oversees the district's strategic efforts to eliminate disproportionate discipline and academic outcomes and promotes educational equity for all students. In her current role, Dr. Huddleston supervises programming related to mental health and well-being, including social emotional learning, behavior support, PBIS, social work, school psychology, Section 504, and school health. She's got an awful lot on her plate. But another hat that she didn't put on her bio is that Dr. Huddleston is also the formal liaison between the school system and the Decatur Parents Network. And we just feel so very grateful to have her and so appreciative of her being willing to moderate this discussion tonight. So welcome. I hope you have a very gain a lot of knowledge this evening.
Thank you so much, Terry. Thanks for that introduction. I'm just delighted to be here tonight with these amazing panelists that we have to share information with you. So tonight's webinar was based, as Terry mentioned, on the survey that many of you probably completed this summer. And our panelists are going to cover many topics and themes from the survey as they discuss their areas of interest and expertise. So we'll start with an introduction of each panelist as I introduce them. They'll talk to you a little bit about their areas of expertise. And then we'll go on to the next, and then we'll try to save a little time for some questions at the end. So please hold all of your questions until all of the panelists have had an opportunity to speak. So I'll get started with our first panelist, who is Kimberly Evans. Kimberly is a licensed professional counselor, approved clinical supervisor, and national certified counselor. She graduated from Georgia State University, go Panthers, with undergraduate degrees in psychology and sociology, and returned there to receive her master's and educational specialist degrees, both in professional counseling. Kimberly comes to Decatur High School with 12 years of clinical experience in both private school and public school settings, and her interests include neurodiversity, transition-related support, cognitive behavioral therapy, self-advocacy, work with teens and young adults, and family therapy. So we welcome Kimberly Evans.
Thank you so much for that wonderful introduction. It's really great to be here with you all. I wanted to start by just giving a little bit of information about the Student Center and some of the services that we provide to our students. So we are, at the high school, essentially, we serve as a walk-in clinic for a lot of our students. So if someone is upset or anxious during the day and needs someone to come in and talk to, or needs a place to kind of regroup and relax, we can provide that for them at the Student Center in our new beautiful space at DHS. But we also have a number of therapists and counseling interns working with us that can provide individual counseling support. And we're also going to be working on some groups as well. So some of these will be typical support groups or counseling groups. There will also be some what we call psychoeducation groups. And those are groups where you have an opportunity to learn a new skill with other people that are maybe interested or could benefit from learning those skills too. One of my big topics of interest is actually the topic of transition. And so you can think about transition as sort of going from one thing to the next, but it's also very focused on change. So all of us experience transitions in our day-to-day life, but these can actually be sometimes a source of anxiety or stress for adults, but also for our students. And so when you think about transitions in day to day, transitioning from one class to the next, or transitioning from being at work and then going home and being a parent or a sibling, those are all transitions that we do. And most of us do them seamlessly throughout the day. But there are also bigger transitions, right? So imagine graduating from high school or starting a new job. Transitions, whether they're big or small, can cause a lot of anxiety and stress. And particularly if we're experiencing a lot of those at the same time, it can become very overwhelming. So with a lot of our students, the last year and a half has been basically one giant phase of transition. And of course, I'm talking about the elephant in the room of COVID and how that has impacted all of our lives. But I've especially been thinking about this with our students as we've transitioned back into fall semester. So one of the things that we have been seeing with some of our students is that they are experiencing a sense of loss or grief from the things that they have missed out on for the last year. As our students age, but even starting at a very young age, they're gaining more independence as they continue to get older. And a lot of that was taken away. So that disrupts your social circles, it disrupts your routine, which is very important for a lot of us to help maintain our own levels of stress and anxiety. And they also were sort of a lot of the things that they enjoy doing, their hobbies, being with their friends, all of those things were put on hold. And that can really increase your feelings of stress and anxiety. So for mental health professionals, when we meet with people who are experiencing these things, we talk a lot about coping skills and resiliency. So really teaching our students how to focus on what they can and cannot control, because unfortunately, there are some things that are just out of our control that we have to develop coping skills to work our way through. That being said, there are also things that are very much within our control, and maybe learning new skills or asking for help can sort of help you to navigate some of those. So, one of the things that we encourage with our students is talking about those sources of anxiety and then identifying things that might be able to help them. So sometimes this looks like taking data on your sensory system. If you're feeling stressed out, are noises making that worse? Maybe it helps you to listen to some music, or maybe you can put in some earplugs so that you can sort of block out some of the noise. We also teach students deep breathing because it's really hard to think logically about any of the coping strategies if you're in a panic and if your brain is not getting the oxygen that it needs. We also teach students about how to be more reflective and kind of slow down some of their thought processes. So that might look like muscle relaxation or journaling. Sometimes it's also nice to talk to a mental health professional, but also a trusted parent or friend or someone else that you know has had a similar experience. That helps us to feel less alone and less isolated. And that's always sort of encouraging for anyone that's going through any kind of stress or anxiety. There are things that parents can do at home that I like to encourage that actually don't involve you having a mental health background or don't necessarily need to be particularly time consuming. One of the things I encourage students and their parents to think about is going back to the basics of wellness. So, are you getting enough sleep? Are you eating healthy? Are you moving your body? Because that really helps to put a little physical stress on our body so that the emotional stress we experience every day doesn't overtake us. It's also important, I know this seems basic, but to just listen. So talking to your students at the end of the day or wherever it fits into your schedule, even if it's just a few minutes, asking them what is going on, how they're feeling, what they're worried about, if they have questions. This also means, though, that you have to be a role model for your students, which can be really hard. They are looking at us to see how we manage our own stress and anxiety. And so having healthy coping skills for yourself is also going to be really important and help your student indirectly. You can also ask kids about what's on their to-do list. So by this, you're kind of figuring out what is it that's on their mind? What is it that they're really focusing on and that's taking up a lot of their energy? And can you help them to sort of put some boundaries or some structure around that to get it done? So maybe talking to them about what's on their to-do list and then helping them to make priorities about what might be the most important or what's due first. That can sometimes help them to talk through what feels overwhelming so that they can sort of narrow it down. Also, maybe resisting problem solving sometimes. So we are all of your wonderful parents. You want to jump right into solving your kids' problems. Sometimes that isn't what they need. Sometimes what they need is for someone to listen to them, and they will often be able to come to their own conclusions or solve their own problems. So you can engage in brainstorming where you are both making lots of suggestions that they can sort of see that there's more than one solution to their problem. But it also shows them that you're giving them the space to sort of think through some of those things on their own. Also encouraging them to advocate for themselves and ask for help if they need it. There are people at school. There are also mental health professionals in the community. And, getting help is something that we should really be encouraging all of our students to do and do early on. One of the things I've been making it a habit of when I meet with students is I thank them for prioritizing their mental health. And they all really get a kick out of that, but I really mean it. It's the type of thing where if you get ahead of it before you are too stressed, it can make a huge difference. And then I encourage you all to just be thinking about setting family rituals. Are there things you can do to put a little bit more routine into the week, ways you guys can spend meaningful time together? Those are some helpful tips that I think maybe you guys could use at home. And I think that's about my time.
Thank you so much, Kimberly. All right. Our second panelist is Fonta High. Fonta is a licensed professional counselor, national certified counselor, addiction counselor, and EMDR therapist, and that stands for eye movement desensitization reprocessing treatment for trauma. And she has 15 years of experience in treating mental health disorders. She works with adolescent, oh, there goes the timer. Sorry. She works with adolescents in middle and high school, treating mental health challenges to include anxiety, depression, in addition to adjustment issues, substance use, interpersonal challenges, and difficulty managing stress to help students achieve academic success and improve their overall well-being. In her private practice, she also treats adults using evidence-based interventions such as cognitive behavioral therapy and mindfulness with a person-centered approach. She's passionate about helping others to achieve healing in order for them to reclaim their lives. All right, let's welcome Fonta.
Good evening, everyone. And Kim, you hit on a lot of different points I wanted to touch on. So I'm going to be briefer than Kim because she gave y'all a lot of great information. But one of the points that stood out to me that was a point of concern for parents was around mental health and substance use. And so I think anytime a parent discovers that their kid is using drugs or alcohol, they almost automatically, I see, go into crisis mode. But what's important for me to communicate tonight is perspective around that. And so if you discover that your kid is using alcohol or drugs, it's certainly not because it's just bad behavior or there's something bad about them. But again, this is someone who's trying to cope. And Kim talked a lot about stress. And so please look at substance use. If you discover that your kid is using substances as an opportunity to help them to cope differently. They're looking for a way to cope and they've found drugs and alcohol as a way. And certainly sometimes that's them coping with an undiagnosed or underlying mental health challenge or diagnosis, but how you approach it is critical in helping them to make whatever changes that are needed. And again, there's a direct correlation oftentimes between those mental health struggles and stress and their choice to use substances. Understanding why they're using is really important. And just know you don't have to figure it out all by yourself. There's mental health professionals that can do assessment and do accurate diagnosis for you around that. So please reach out to a mental health professional. Don't feel like you're alone in that, but do go into it with curiosity, trying to understand what the use is about. And again, versus just looking at it as bad behavior. So that piece around stress is really critical. And right now, I think everyone is more stressed than normal because we're living in a pandemic. And so how someone responds to stress can make the difference in lowering anxiety or keeping them from experiencing anxiety, because anxiety is a response to stress. So certainly, as Kim already mentioned, modeling good mental health care around your own healthy practices is really critical. So one of the things we want to be careful that we're not saying around our kids is giving messages that suggest that substances are the way to cope. And so that can look like being careful of saying something, I need a drink. And certainly we may want to drink as adults who are of age to consume alcohol, but what does that communicate to our kids when things? What's more important is that we're demonstrating how to cope healthily. And so modeling that self-care is really important for our kids. One of the reasons that our kids struggle is not knowing how to structure their time and balance everything that's on their plate, academically and socially. So sometimes they need that guidance. So have that conversation with your kid around structure if you see and ask, do they need help with that? And how may you help them with that? So them figuring out how to balance responsibilities with their social life could be a critical way for helping them to reduce stress. Also, that can look like engaging in family activities. As we talk about what self-care can look like, doing it with the family unit is a certainly making sure they have time to do things with their friends in creative and safe ways is important, in addition to giving them time and making sure you're supporting how they can engage in individual activities that they enjoy and that are important to them, and letting them know that it's important for them to prioritize that. And certainly we live now, I think, in our personal community in a place where I think that academic success can be over prioritized. And I want to say to the parents that it's not an either or. Certainly it doesn't have to be academic success and achievement over your mental health. So your students can be incredibly successful academically while prioritizing mental health. I think there's not room that's left for that focus on those things that are going to help our students to de-stress and focus on what's important to them. Such a drive to achieve, but making sure there's balance for both is important. And again, it's not either or. And so the last thing I also want to speak to before my time is up is something that's been present in our community, which is around suicide. And definitely we're going to do a deep dive into that. DPN is next month around suicide prevention. And I think much like with substance use, certainly if a parent discovers that there's some suicidal ideation with their student, that definitely really shakes us to the core. And so not knowing what to do, I think the quick response that we're seeing from some parents is filling out the counseling referral form. We still want you to fill out the counseling referral form for the Student Center that you can find on the website, but also the resource that was shared with you at the beginning of this webinar with GCAL, the Georgia Crisis and Access Line, and the National Suicide Prevention Line is an important first go-to. You don't have to wait for a mental health professional to engage your child if you're discovering that they're having thoughts of ending their life by suicide. You can contact GCAL and have a mental health professional do an assessment for you with your child. You can contact the National Suicide Prevention Line. We want to ask you to do that as opposed to only filling out or first filling out that referral form. And after you've after you've contacted GCAL or the National Suicide Prevention Line, please do fill out that counseling form, but also know that you can call up to your children's school and call the front desk and find out who their counselor is. Has an assigned school counselor, and do send an email or have a conversation with that school counselor if you discover that your child is struggling with suicidal ideation and they've had an assessment. We want to be able to support you with that. So after you've been able to have that engagement with Georgia Crisis and Access Line, we do want to be aware so we can provide those supportive services through the Student Center at whether it's the elementary school or Renfro or Decatur High School. So please make sure you do follow up with the school counselor, but feel empowered to contact a local mental health professional through those resources provided at the beginning of the webinar.
All right, thank you so much, Fonta. Okay, we have one more panelist tonight. Our third panelist for the evening is Sara Melito. Sara received her Master of Science degree in Clinical Mental Health Counseling at Georgia State University and is a licensed associate professional counselor in Roswell. Sara specializes in LGBTQIA+ youth and assists adolescents in building a strong sense of confidence and identity within themselves. In addition to working with adolescents, Sara works with younger children and adults while working towards her registered play therapist certification. So welcome, Sara.
Thank you, Dr. Huddleston, for that introduction. And thank you so much, Kimberly and Fonta, for everything that you've touched on prior. To me, I feel like you both have just set this up perfectly, because what I would like to offer for our parents tonight is some extra understanding as to how anxiety and depression manifests in our children and how it presents in the ways that it does. When I work specifically with my parents in private practice, the number one question is, why can't my child understand X, Y, and Z? Why can't my child cope in the same ways that I can? Things like that. And I find that it's really important for parents to understand that when we are specifically working with adolescents, but also younger children as well, we're working with different forms of brain development. And so that's where I would like to start tonight, which is with our prefrontal cortex. Our prefrontal cortex, located at the front of the brain, is our last piece of the brain that develops for us in adulthood. So for most people, that's between the ages of 25, 28. Some people, it could be all the way up to 32. For our kids, their prefrontal cortex is not fully developed. It's not even really, it's maybe a little bit over halfway fully developed at between the 12 to 18 range. Our prefrontal cortex is in charge of our personality development, our decision-making skills, how we determine what is right, what is wrong. how we make complex processing. It's even a part of our social skills development as well. So anytime that you are sitting in maybe a work meeting and you're wondering, should I speak up? Should I say this? Should I make this joke? That's your prefrontal cortex speaking for you. Now I want you to imagine being 13, back whenever that was for you, and trying to make those same judgments. It's really hard to do that at that age because you actually are missing a very vital piece and a very vital organ of your body. Because of this, our adolescents are super susceptible to depression and anxiety. They are trying to navigate a complex world with complex processing without the most vital skill that they need to do that. And it's almost unfair when you think about it, because adolescence is the number one time where we are learning how to engage with our world, where a lot of kids between the age of 12 to 18, they're being introduced to complex processes, sex, drugs, intimate relationships in general. Some of our kids are going through divorce or family dynamics during this time. There's a whole host of things, not to mention COVID-19 pandemic, right? And so they are, in a normal circumstance, supposed to glide through adolescence, slowly bringing in and sponging in all these different stimuli that they're getting. But that's just not the world that we live in. We don't live in a world, especially with the rise in technology and social media, they have stimuli everywhere. And the brain just has not been prepared for that. What happens, and what I get asked all the time by my parents, is why do things like self-harm come up with my teen? Why do disordered eating patterns come up with my adolescent? Why are those the first things it feels like that my teenager or my child are reaching towards instead of what we call more effective and safe coping mechanisms? And the reason for that is because, again, the prefrontal cortex isn't fully developed, but with all of us, adults included, all of our brains are constantly looking for a dopamine response. And dopamine is a neurotransmitter in our brain that gives us pleasure, gives us joy. That's what we experience when we have sex. It's what we experience for those of us who like Starbucks coffee, that first sip in the morning. That's dopamine response, 100%. And our children are super susceptible to that below the age of 25. 100%. And just as susceptible as we are to it as adults, they are more so. And so when they are struggling, when they're experiencing depression, when they're experiencing anxiety, their brain is quite literally telling them to go towards what is the easiest, the fastest way to cope, and also telling them to go towards what everybody else is doing. And with the rise of social media, teenagers are more aware of self-harm, are more aware of ineffective coping mechanisms, are more aware of disordered eating patterns amongst their peers, and they're seeing a lot more of that. TikTok, Instagram, Snapchat, they're awesome tools to connect and socialize with each other, but they're also can be harmful when other adolescents and teens are teaching each other how to engage in ineffective coping mechanisms. So it's a double-edged sword. And so our teenagers are going to immediately want to pick a release, such as cutting themselves, starving themselves, making themselves throw up, whatever the form of self-harm is, so that they can get that dopamine response and feel better. So what we do, and what I know that our amazing counselors in the Student Center do, what I do in private practice and my practice with my kids, is we aren't looking at shaming that behavior. We aren't looking at saying, no, you are bad for self-harming. No, you are doing the wrong thing. We're saying, we see what you're saying. We see that you're asking for help. Let's redirect this behavior. Let's try to pick something that is safe for you, that keeps you safe. And in doing that, by reframing that language, we're opening the door for our kids to understand being depressed and being anxious is okay. We all get depressed and we all get anxious. It is okay to ask for help. It's even okay to engage in self-harm once you start understanding why it's happening. And once you understand that it's necessary to stop. All of these things are necessary. And that leads me to my last piece, which is what Fonta and Kimberly mentioned so eloquently, is having an open conversation with your children. Be okay with being vulnerable with your children, with asking them point blank, are you okay? And not beating around the bush. Ask them if you suspect that they're hurting themselves, if you suspect that they're not eating, ask them point blank. are you engaging in these behaviors? You'll be surprised. Your 15-year-old will most likely tell you. And then when you have that conversation, allow them to be part of the decision to seek therapy. And if they do decide that they want to seek therapy, let them find a therapist for themselves with your help. I can't tell you how many parents I get. Literally just had a conversation 2 nights ago with a parent who called me saying, my child found you. I know nothing about you, but my child wants to see you. So you tell me why I should let you work with my child. They know how to find these resources. Let them do that research. And just like Fonta and Kimberly said, have open table discussions. Talk about it at dinner, talk about it over some ice cream, and then make a plan together. And then discuss that with your therapist. And I think I'm right at time. So.
Okay, thank you. Everybody did such a great job and said so many wonderful things in a very small amount of time. So thank you so much for what you've contributed so far. We have a good amount of time for questions, and I'm just going to take a look and see if we have any questions in the chat so far. Okay. I don't see any so far, but there were some other questions that were touched on in the survey, and I can just mention some of those and see if either of you would like to jump in and talk about those. So one of the questions, and Fonta, I think you touched on this a little bit, was sort of looking at the academic achievement, competitiveness, and things of that nature that we sometimes see in our community. And given that, being able to balance that and not have stress, be overcome by stress and things of that nature. Would one of you be willing to just sort of delve into that a little bit deeper?
I'm happy. Go ahead, Kim.
No, I was just going to say that one of the things that people often overlook is that some of the high achieving students that have a lot of academic rigor in their schedule are often seen as the students that already have better coping skills than others. And while in some instances that may be true, a lot of times they are also really overwhelmed. So one of the things that I talk about with both students and their parents is to think about setting realistic expectations. So in a perfect world, yes, everything that you do would be perfect and would be A+ work. But there are times when you have to prioritize your mental health, or you have to prioritize having some free time or some play time or some things that you can do that you enjoy, or spending time on your hobby. And in those times, it is important to talk about what the priority is, right? So maybe put all of your energy into studying for an AP test. And then maybe there's a project where you make really good grades in that class and it's okay to make a B or even lower than that. There are times where I think we just have to be realistic instead of encouraging kids to always shoot for their absolute best, because I think they already know that and they expect that of themselves. But to have more of a realistic view and to also know that it's okay to make mistakes, and that mistakes are inevitable. We all make them, and we all sometimes need a little extra help or have to kind of phone it in occasionally when we're extra stressed or when we're not feeling ourselves. Fonta, did you want to add something to that?
Yeah, it's somewhat similar, but it's around the idea of letting go of things that are not essential. And I think in a very competitive, high achieving environment that we're in, we try to do all the things, all the different sports. You have multiple kids in the high school. Parents are active in PTA and other community activities. And it's really important to focus on what is essential. And if something isn't, being willing to let it go, to make room for those mental health practices around self-care that we've been talking about. Because otherwise what ends up happening is we're opening the door for the things that Sara talked about, those dopamine driven activities. Looks like substance use, that looks like other forms of self-harm. And again, we're more likely to see that when we're not actively trying to balance life and reduce stress. And then anxiety sets in, and people can't just constantly live in an anxious state without eventually doing something to try to reduce that down. So it's really important that we let go of those things that we can, focus on what's essential, and we prioritize mental health, or otherwise we're opening the door for unhealthy activities.
Okay. So we are having some questions start coming in the chat here. So the next one is, how much are parents involved with counseling at school? So do counselors share the issues or progress with parents?
I'm happy to jump in on that one if that's okay.
Sure.
So we do try to maintain a level of confidentiality with our counseling clients. So this is actually a really important part of the counseling relationship. And I think parents are often a little confused about it, as are teachers and other staff at the schools. So when you enter into a counseling relationship, there is confidential exchange of information, which means that what we talk about is private in there and not something that I share without your permission. That being said, there are limits to that confidentiality. So of course, if you reveal that you're going to hurt yourself or someone else, then yeah, our priority is to keep you safe, and we're going to break your confidentiality at that time. But that's not something that we're going to surprise students with. That's something we remind them of those limits when we start meeting. We remind them throughout when they're getting close to something like that and they're revealing something. We also remind them that that is that we're mandated reporters and that that's part of our ethical obligation. One of the things that I really encourage with students, and especially with the teenagers I work with, is to work on their communication skills and their self-advocacy to share some of that information on their own. So instead of thinking, I'm going to go tell your parents what's going on, what's keeping you from telling your parents what's going on? And how can I help you to communicate that with your parents or with your friends or with whomever else you're keeping this from? What is it about this topic or this issue that's making you feel like you can only talk about it in a very private or confidential place?
And certainly I would say, Dr. Huddleston, when parents are practicing more of what we've talked about in this webinar, approaching their children, having open dialogue and being curious about what their struggles are, I think that creates a relationship that makes it easier for students to do Kim is saying. So I really want to encourage parents to get curious about what's happening with their students, to ask very direct questions and build that sort of relationship. It can be really easy for us as parents to get hyper-focused on what's not going well in terms of what they're not doing, if they're not following through with homework assignments or following through with chore responsibilities, as opposed to asking that question that Sara said, are you okay? What's going on? And when we begin to build that kind of relationship, it makes it easier for the students to approach us with those more intimate things that may come up in therapy.
I would just like to add to that too, and because I know I don't work in the schools, I have done school counseling at the college level, not the high school level, but it all connects, because I have found that even if you decide that you do want to find a therapist for your child outside of the school setting, there have been numerous times where I will connect with the school counselors at the school. And so then there are added levels of support based on when, if parent and child agree to that, right? So you have multiple levels of ways to help really armor your child with mental health support in your community at the school level and the private practice setting. And there's so many different ways to find a therapist as well. And we can talk about that a little bit later if anyone's interested in that too. But I really wanted to just stress that parents, you are involved in every step of that process, like Kimberly said. It's not going to look like us running to you and telling you everything your child has said. But if your child is in danger, we are going to not just be communicating with you, with your permission, with the child's permission, we'll be communicating with each other. And an example would be if I have a client and maybe Kimberly and I share a client, right? Maybe a client is at the school and I have this client. Kimberly and I, with your permission, can work together to make sure that the client is receiving correct services at school and correct services with me, and that mom and dad, you all are getting everything that you need at home too. And I just think it's so important because so many parents don't even realize that that is a possibility, that we can all talk to each other with your permission, of course.
Okay, we have a question about the student center. Will the center be offering DBT groups?
Yes, I was just debating whether I should answer that in the chat or not. So DBT is very popular right now. It's something that a lot of people are asking for, and it is very much on our radar. So we are hoping to provide DBT groups in the future. Not only is our counseling staff doing research on how we can receive more training and get certified in this, but we're also looking for therapists in the community that can help us to serve this need. Right now, what we're planning for in fall semester are some groups that have very specific focuses. So we're going to do like an executive functioning skills group, right, which is helping with like organization and time management and learning how you learn best so that you can sort of work towards your strengths. We're also going to do an anxiety and mindfulness group. As opposed to DBT, I would say almost all of our therapists that work through the Student Center utilize a lot of CBT, which has some very similar elements, but we want to make sure we're just fully qualified to be utilizing DBT more fully in groups. And that is something that we're working on in the horizon.
Okay. One of our participants shared, I think a number of kids lost friendships during the pandemic and are grieving that loss. And this loss has also affected their confidence and willingness to take social risk. How can parents effectively encourage their teens to put themselves out there again and seek making new friends?
Oh, Kimberly, if you want to jump in on that, it's totally fine.
Well, I was just going to say that one of the things that, again, this is kind of a back to the basics, but I always remind parents, one of the most powerful things for any of us is to realize that you're not alone in something. And so reminding students that their friends feel that way too. Since school has started, we've had a number of students coming into the Student Center that feel like they no longer have friends. And so reminding them that all of us have been isolated, that they weren't locked in their houses while the rest of us were continuing to live life. Everybody's life hit pause. And that as nervous as they are to re-engage in those relationships, their friends and their peers are just as nervous. So, and you can maybe even share, again, as a positive role model, that you've experienced that in your life too, if you have, because I think a lot of us have that sense that our social circle has shrunk or gotten much smaller. And now it also feels really hard to go back to the level of socialization that maybe we had a year or a year and a half ago. So again, just kind of like normalizing that for them is something really great. And then reminding them of things that they used to enjoy doing and suggesting, hey, didn't you and your friend so-and-so used to love going to do this? You guys should do that again. Things like that. Sarah, what were you going to say?
Absolutely. On the other side of that, what I've seen a lot post-pandemic, during pandemic, is that students who are usually, or clients who are more introverted by nature, have kind of, over the past year, this has been a way for them to slip back more into their introversion, which there's nothing wrong with being introverted by any means. It can just be harder to get out of those coping mechanisms where you're so used to being alone and being able to do things on your own. And so I have had lots of parents ask me, how do I kind of push my child to go back and make some connections? My encouragement, if you are a parent experiencing that and wanting to kind of push your kid, closer to making connections again, let that mold the way that it's going to. Let that form naturally, because personality wise, we don't want to push our child before they are ready developmentally to make a next step. And so for some of our kids, they are ready. It's just a matter of, how do I find groups? How do I find friends? Like, who do I sit with? All these things. And for others, it's a little bit less than that. It's a little more scary. And that's okay. And letting them know it's okay. It's okay if you want to kind of touch your toe in the water a little bit. And it's okay if you don't know exactly how you want to make friends or what you want your friendships to look like. If you want to practice, we can practice. If you don't, that's okay. But just giving them a little bit of that compassion that I believe Fonta was talking about earlier. When you open that conversation, being prepared to say it's okay with how you're feeling. It's okay that you don't want to reach out yet. That's all right. Let's figure that out together.
We have a question that pertains to our younger kiddos. So for younger students, they have really big feelings and emotions, but don't have the language to express what's the root cause of those feelings. So for parents of younger students who are showing signs of stress, what would you suggest to help them figure out what's going on?
I will absolutely jump into this one as a play therapist in training. But with our younger kids, play, 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 play. That is how our kiddos communicate. They communicate through play. And I cannot stress with parents enough, play with your children. Play with them, watch how they're playing, watch what they're doing with their play, watch how they're engaging with you in play. What are their dolls stressed about? What are their action figures fighting against? Are their action figures constantly being caged by something? This is something that can absolutely give you insight into how your child is feeling. I also very much suggest, if you're willing to do so, work with a play therapist. It will open up so many realms of communication for your child. But if you're not ready to do that, or if that's just not feasible, then do some research on your own of what play looks like for a child, how they communicate through play. Because what you're going, whoever mentioned that question, you're absolutely right. Our kiddos under adolescence, they are not going to express themselves in the same ways that our adolescents are. They're going to get more hyper when they're stressed or even depressed. They're going to maybe get a little more irritable, withdrawn, set up stronger boundaries with us. It's a whole gamut of things that our little kids can do. And the best way to walk into that is, again, open door conversation, but in their language, which is play, 100%.
All right. Here's another one. My senior and I have good communication, and she's requested to seek mental health support just for peace of mind to navigate all that's going on with being a senior. Her son is a sophomore and is not as open, but she can tell there's something going on. So she wants to know how she can encourage him to open up with someone else. It's not easy to get him to open up.
One of the things that I find really powerful for a lot of adolescents is sort of seeing what their peers are going through. And so sometimes for students that maybe aren't open to seeing a therapist, you can maybe suggest some social outings with some friends that you know are easier for them to talk to, or providing them with opportunities to be with other people that they feel close with, that maybe they will open up to those people. One of the things that I like to emphasize is the power of group therapy, right? So we've talked a couple times today about feeling like you're not alone. If you look and do research, you can find social groups, or you can find other opportunities for teenagers to be around their peers. And oftentimes what I have found is that if somebody who's less willing to open up sees one of their peers open up, or hears that their peers are experiencing something similar, they immediately have a reaction to that and want to engage around that. It's also, I think, really great for parents to model talking about how they're feeling regularly. That will normalize it in your family and make it feel less risky for your teen to open up about how they're feeling. If you come home and say, I had a really tough day, or I am feeling really anxious about this meeting tomorrow, that is something that a lot of kids don't get to see. And it is really positive modeling to kind of name those feelings and talk about how sometimes you just feel off, because that's just true for all of us sometimes.
Absolutely. All
Fonta,
right.
I also feel like you would be able to offer some great insight into this as well for our parent who asked this question. I'd love to hear both what you and Kimberly have to say.
Yeah, definitely Kim hit on some important points that I would have definitely made mention of as well around that normalcy, that it's okay to not be okay, essentially, right? And I think sometimes we as parents feel the need to put on a certain air that is counterproductive to us being able to move into a better state of mental health. And I think that also comes along with this high achieving environment, right? Where we're supposed to be able to do all the things and handle all the things, right? Without looking like we're breaking a sweat. But that gives a very unhealthy message to our kids, and they can then internalize and hold this pressure to do the same thing, to juggle lacrosse, to juggle soccer and swimming and make all the A's or all the sevens, right? And then just keep pushing through it all. So again, making sure we're communicating a message that it's okay to not be okay, and then being willing to talk about, again, what's going on, and asking that question, like you said, Sarah, then allows the opportunity for our kid to feel more comfortable with maybe opening up with us, someone else they trust, or then seeing a mental health professional. So it's about that, again, environment of what we're creating and the message that we're communicating in our community, and working to change that in that manner.
I have one more trick of the trade that I just thought of that the parents might actually be really interested in, is sometimes when I have a student that I can tell doesn't want to open up, I will just take a guess at how they're feeling and say it out loud. And sometimes I will even guess a little off, so that I am purposely saying like, man, you look really frustrated. And that gives them the opportunity to say, no, I'm not frustrated. I'm mad, or I'm not frustrated. I'm really sad today. Giving them the opportunity to kind of like fix what you said, right? Because parents, we never get it fully right. But if you take a stab at it and say out loud, like, yeah, I'm just wanting to check on you. You seem really anxious. They might say, well, I am really anxious, and then open up. Or they might say, no, I'm not anxious. I'm feeling something else. But giving them an opportunity to correct it, even if you take a guess and it's not right. I have kind of tricked people into opening up because they want to quickly correct my misconception. And that sometimes is a nice way to just get a conversation started.
Kimberly, we call that motivational interviewing, right?
That's a good one. All right, we have another question about the Student Center. Julie wants to know what the status is of the Student Center at Renfro, whether they'll have the same level of services as the high school, and if there is a peer-to-peer support program there yet.
Yeah, services are building at Renfro. I actually spend part of my time working at the Student Center at Renfro, and we're working on getting groups up and going. It's fully open where students can walk in, just like at DHS, like it's a walk-in clinic, as Kim mentioned, and they can see a counselor. And so the same services being provided at DHS are open at Renfro. And yes, there'll be even that peer-to-peer engagement as we build up therapy, which looks like psychoeducation or self-advocacy at Renfro as well. And so when a parent fills out that counseling referral, wherever their kid is at, again, those services are provided at the elementary level. We have therapists there, we have JD going there. I'm at Renfro and I'm at DHS. We have Kim at DHS, and we have interns at multiple schools as well. So yes, fully operational, absolutely.
Okay. We had a question that came up in the survey that I don't think we've touched on, and that is, how can people access mental health supports and services if they don't have insurance? What are some options for people who are not necessarily plugged into those resources?
Absolutely, I can take a dive at this one. So there are multiple different ways, all the way from, just word of mouth to doing an internet search. I always direct my clients first and foremost to Psychology Today. And Marnie, if you're listening, if you could do a plug in the chat for that, that would be awesome. Psychology Today, it's almost too simple, but I always still refer my clients there, or anyone who's looking for services, who doesn't have access to insurance, but who is looking for a sliding scale therapist, because there are plenty of therapists out there who don't take insurance, or you don't have to see them with insurance. However, they may still not be affordable depending on your financial needs. And so you want to look for a sliding scale therapist who might be able to work with you in that way. And thank you, Marnie. I just saw that. And so Psychology Day, you can go on and you can search by your zip code, who you're looking for, even down to gender, down to specialization. And then of course, if you do have insurance based off of the insurance policy that you have, or if you don't, you can look for sliding scale as well. There's a tidbit on there as well. The other resource that I always offer is the I think it's the Care and Counseling Center of Georgia. Is that right? I always get the words mixed up, but Care Counseling Center of Georgia. They are a low cost counseling services, usually in the metro area. So it might be a little bit far for my outside of the perimeter folks, but I'm assuming most of you guys are inside the perimeter. At the same time, you know, depending on access and how ease of access it is to get to those places, you might want to also use Psychology Day so you can find people who are doing virtual and doing sliding scale and things like that. So those are my two plugins I like to give.
Actually, quick correction, Sarah, if you're talking about the Care and Counseling Center of Georgia, that was around for over 40 years. They closed.
No.
I used to work for them. They were incredible.
Okay.
But yes, so
Yes.
DeKalb Community Service Boards or any of the community service boards are great options. Also, there's a Pathways in City of Decatur that we partner with, CSD partners with, that will take those who have, like, for example, Peach State or Well Care. And so those who have sliding scales as well, we can make those connections and help provide those resources. So reach out to the Student Center, fill out that counseling form if you need those connections.
Oh, Fonta, thank you so much for telling me that. I had no idea. That makes me so sad.
All right. There was a question about dedicated wellness activities in the school district. So last year we had Wellness Wednesday. And for those who are in the district, we had an early release from activities on Wednesday to be able to engage in meditation or yoga and things like that were targeted at helping our whole community have that sense of wellness and increase that, especially amid the pandemic. So we don't have that focused Wellness Wednesday activity and that dedicated time this school year. But I've been talking to my colleagues about Feel Good Friday. That's my next inspiration to sort of recommit ourselves to that. So of course, we still have all of the resources that Fonta and Kimberly have talked about through the center and many activities in terms of social emotional learning through our C learning activities that we'll be weaving in this year. But just wanted to share that the district has not forgotten about this, and we definitely want to amplify opportunities for staff members who really have been at this for, you know, quite a while, going from virtual to in person and just having so many transitions. We talked about transitions tonight. So we will be having other activities that we put forth as a district. So I wanted to jump in and make sure I touch base with you on that one. Oh, I see the slide. I think we're getting close to the end of our time. Is that right? Yes, we are. Terry, do you have any sort of culminating thoughts or ideas that you want to share with everyone before we wrap up? I think you're on mute.
There we go. Pandemic time, right? Wow is one thing that I can say. What an incredible panel, and for the moderator as well. I want to thank everyone so much for doing this for the Decatur Parents Network. And folks, it is very important to know that at the end of this, you will be getting a survey. Please take a moment to fill that out, because your surveys drive these programs. And as they drive the programs, they let us know what topics you're interested in. And the Decatur Parent Network always makes a point of trying to meet your needs, but also know that you can reach out to us through our website, as well as reaching out to all of our wonderful panelists this evening. And note that we do have, again, the event coming up on September the 9th at 7:30. That will be a little bit later in the evening. That will be at 7:30 to look at teen suicide. We also have another event on substance use that is also, that presentation is appropriate for teens and parents. And that will be happening next Thursday night. Check our website out at DPI's website. And also there will be another presentation late in September on addiction that will also be for teens and parents. So two for the next 2 months for parents only and 2 for parents and youth. So I want to thank everyone. And Dr. Huddleston, do you want to lead us out?
Sure. Thank you so much to our wonderful panelists. We just learned so much from you, and we have a wealth of talent and knowledge here in our community. So thank you again for being here, and thank you to all the parents who have joined us tonight. Please tune in, just as Terry has said, to our upcoming events, and we look forward to seeing you soon.